At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Chronic Arthritic Pain on Wednesday, April 10th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. This is Dr. Tom Roselle. Got a great program for you today, kind of follow-up. It's a beautiful day, and we're all getting ready for the eclipse, right? And what that's going to do to all of us. But you know what? Don't worry about it. Just make sure you don't look at the silly thing straight up. You know, there are glasses for that, and there's some other things. But if you're like me, I'm going to be seeing patients all day, and I'm going to watch it on the news. So, you know, let's do that together. Just be real careful. I don't want anything to happen to your eyeballs. It's not a good thing. But this happens, you know, on an ongoing basis, and we all want to see it. And you don't have to be right there in the middle of it to do that. There's other ways of making it happen. So make sure you understand that, you know, you have to protect yourself. Having said that, let's get into the program today because it's an important one. It's leading up to this Wednesday evening, the 10th, at the Roselle Center for Healing in Fairfax. We're going to be talking about arthritic progressive joint degeneration. You know, when you go to the doc and they say, well, what do you expect for your age? You have arthritis? Well, I don't know about you, as I've said 1,000 times, that I don't expect to get that way. But I've learned a lot over the last several years and things that I knew to exist, but I didn't think it was going to come to me, but figured out how to way to handle that. What are we talking about? We're talking about joint degeneration and the like. So think about it this way, and we'll take the person that would be least likely to have any kind of broken anything. You got somebody who's fit and they're athletic and they don't eat too badly at all, and all of a sudden they're getting joint pain and they start losing motion and they can't figure out what happened. And they go to the doctor and the doctor says, well, you have arthritis. Remember we said the itis is inflammation. If you hear the word arthrosis, that simply means that the joint is broken down. So we have to look and see which is which. So how did this person who's athletic, who eats well, who's not overweight, end up with all of this joint degeneration systemically through their body? And now they're looking at multiple surgeries, perhaps. They're looking at spinal stenosis. They're looking at replacement of knees and hips and shoulders and things of that nature. Is there an underlying common cause? Well, I'm here to tell you that there might be. And this Wednesday evening, I'm going to get into it very, very specifically. We know that there are things that cause joints to break down. One is you're way too heavy and you have all that weight on your joint spaces, and it's unfortunate, but guess what? There's a end product because of you not taking care of yourself. You don't get in shape. The only thing that you do is click the remote or get up to go to the kitchen and get something out of the cabinet. You don't eat very well. Tons of carbohydrates. You don't get clean meats. You don't get enough vegetables in your diet. And you're not as hydrated, called water. You know, water, we're not talking coffee. We're not talking other things, but we're talking water, lots of it, you know, to buffer those joint spaces. You've heard me say 1,000 times that the consistency, the content of the spinal discs is 75% water. So if you're not getting water, not those other things we talked about, you're going to have joints that are going to be rapidly compromised and end up being degenerative over a period of time. So let's talk about what we're going to talk about today a little bit. The one thing that most physicians, most patients don't get when it comes to osteoarthritis and what the triggering mechanism may be, this thing that I'm going to tell you about in a second, when somebody is in really, really good health condition and does everything they can, you know, to try to set this aside. And gosh, there's no there's no arthritis really like this in my family. What's the deal? What are we talking about? We're talking about viruses, and it's called viral arthritic patterns that cause dramatic inflammatory reactions and swelling in the joint spaces, and subsequently causes this degenerative change to begin to move forward very, very rapidly. And the other unfortunate situation is that when it is found, it's found too late, and the damage has already been there. But I'm here to tell you that it's never too late. There's a lot of things that you can do to reverse many of these conditions, and we're going to get into that this Wednesday evening. And by the way, to register for that class, you can do it one of two ways, one of three ways. You can go directly to rosellecare.com. That's ROSELLECARE, or go to drtomroselle.com. And you'll make that happen like click of a switch, right? Or call the office. You want to do it the old-fashioned way. It's 703-698-7117. And remember, we have limited spacing, so we'd like you to make that reservation so we can prepare for you properly and make sure that you get everything that you need to get relative to accommodations. Okay, so let's get into it a little bit. So the bottom line is, can a virus cause osteoarthritis, bone degenerative conditions? And the short answer is, yeah, it can. And so we know that it can disrupt normal function of what we call the joint space, or the articular system, that joint space that has cartilage and things of that nature. And that's why all of a sudden you start seeing the cartilages break down and shrink up and so forth. Types of arthritic conditions that can predispose to this. So first of all, understand, if you get a viral something in your body, you're going to have an inflammatory reaction, inflammation that has a propensity to go to a lot of different places, but cartilage at the joint space level. So the joint spaces become achy and they become swollen and they hurt, and it can happen over a couple hours, and you wonder why it went away. Because then the body kicks in, and then pretty soon it comes up again, and then it went away again. But the periods of what it takes to make it go away get longer and longer, and that's where you continue to see the pain patterns on an ongoing basis. So these viral infections can lead to this degenerative situation that we call arthritis, and it sneaks up on you. But the good news is, if you catch it and you understand it, you can make life a whole lot better. And by the way, remember, I've said over time that as long as you're breathing, you can change virtually anything. In today's world, with the things that we know about in alternative healthcare, there's natural things that we can knock viruses out with and work really, really effectively. There are treatments that decrease the inflammatory reaction and actually will help repair and rebuild cartilage. So various viruses are arthritic triggers. So we can have something like a coronavirus. We just went through that. Oh my gosh, including COVID-19. Yes, indeed. There are many coronaviruses, but we're talking about COVID-2 and COVID-19 viruses. We can talk about way weird things like dengue fever and Zika viruses. Believe it or not, they're out there more so than you would think, particularly in the fact that we have a lot of, our country, our culture is very diverse. Hepatitis, particularly hepatitis B and hepatitis C. And then we have this thing called herpes, and you could have herpes 1 or herpes 2. Herpes 1 is on your lips, herpes 2 is on your genitalia. And then we can get into the more bizarre stuff. We get into mumps, and we can even get into HIV exposure, and you really don't have an active thing. Mumps, if you had it back in the day, and the viruses for rubella and coronavirus. Now, here's the other thing that I want you, and I left out one that I'm going to save till after I make this one statement. These viral patterns will exist even if you didn't have the disease process, if you were exposed to them. How can you be exposed to them? Running off and getting the vaccines? Guess what? Guess what's in the vaccines? The same virus that can cause any of these things to occur. Yep, I said that, right? So I go back to something that I've told you before. When you're listening to these commercials on television, I'll give you the one that everybody's heard, and you'll remember that immediately, is the shingles vaccine. They said, if you're above a certain age and you've had chicken pox, you have the virus that will cause shingles. And, as you get older, you become more susceptible. So there's two pieces to it. Go get your vaccine is what they tell you next, right? So guess what they're doing? They're giving you the same viral component that you had when you had the chicken pox. So why give it to you twice if you already have it in there? But the reason that they don't tell you that this problem shows up is that your immune system becomes more challenging, if you will be very kind, over a period of many years. Why? Because you eat like crap. You don't get the exercise that you should. You're not getting enough vitamin D in your body. High levels of vitamin D. You don't really get sick with a lot of this, and particularly if your zinc levels are adequate as well. But what's the one I'm leaving out that almost 100% of the U.S. population is exposed to? Guess? Real simple. It's called Epstein-Barr virus. That's right. Almost 100%, 98 point something percent of you have a positive Epstein-Barr antibody. And it's also the one that causes mononucleosis. So if you have Epstein-Barr as an adult, that causes a mononucleosis, or what we lovingly call mono, if you will. So if that's there, why does it suddenly show up years later? Well, your body does a really good job generally, if you're in a good place, of protecting you. And you may have these little fevers for no reason at all. You don't feel quite as good as you should, but then it goes away real quickly. In the allopathic community, how are they treating this stuff when you start to feel kind of yucky? Well, they're going to give you what's called NSAID. It's called non-steroidal anti-inflammatory drug. That's called aspirin and Advil and so forth. It reduces the inflammatory reaction. Now, if you remember what I said to you a program or two ago, the problem with using NSAIDs is that it goes to the joint space and competes for something called a sulfite or sulfate ion receptor. So why is that important? Because the sulfate ion is what repairs the cartilage. So now you have the inflammatory reaction that may be due to virus. You have the NSAID in there that's blocking the receptor. So now you can't get the glucosamine sulfate into the joint space for it to work. That's why you go out and you spend all this money on all kinds of different things, and it didn't really work for you, and you still got the problem. Simply because that piece is not explained to you. And how many of you are taking tons and tons and tons of NSAIDs? How many have taken a baby aspirin every day because your doctor told you it's going to save your life because you potentially have a heart problem? Well, your doctor didn't tell you that he's causing you some other problems as well. But having said that, we'll set that aside. That's an argument for a different program. Interestingly, viral infections, and there's some bacterial infections, can cause this multiple joint space problem. It's called polyarthritis. Okay, multiple, poly meaning multiple. So the immune response to the virus can lead to this. So your body just goes crazy. It starts kicking in the inflammatory action. It doesn't necessarily restrict itself to one area. But while we're looking at all this, we have to understand, if we remind ourselves of what happens when this inflammatory reaction takes place. Now, the viruses have a hiding place, several of them actually. One is in the lymphatic tissue of the body. The other is joint spaces. And then guess what? Respiratory system as well. It can get in there and it can hang out. And so we have the nervous system, the brain, and spinal cord. It can get into the lymphatic system, particularly this area called the mesenteric apron. This is big apron that sits over your intestinal tract. There's just one huge lymphatic area. And until you get a lot of stressors, the dietary patterns that we all eat that shouldn't be there, and so forth. Now, I'm going to get into this Wednesday evening and pick it apart. And I'm going to allow you to understand that you have an option here. You can make a difference. You can change the majority of this stuff, particularly if you catch it early enough. Or, you say, oh, what can I expect from my age? And, I'm going to have a hip replacement anyway, or they're going to have to do something with my shoulders anyway, or, my knees aren't, they've never been any good anyway. So we're going to walk you through what happens, and we're going to actually show you some demos of what can take place and what can be made better if you really understand the interconnective patterns and how all this works. Joint inflammation and muscle pain is very common after any type of viral attack. And I'm going to use that as a kind of a general overall basket term for viruses and so forth. So when we had all of this crazy stuff, and called COVID, and we ended up with this muscle and joint pain, and it hurt like crazy. We've got a lot of patients that are walking into the office now that are suffering exponentially, because of that. And if that's the case, what can we do about it? How can we fix it? How can we make a difference? Well, there's ways of doing it. You this Wednesday evening, the 10th, to join me and Dr. Harlan Browning, the professor, if you will, and we are going to pick this apart. We're going to talk about joint degeneration. We're going to talk about how to fix these things. We're going to talk about what you can do to prevent it from happening. You don't have to be the guy that has to suffer and look forward to paying the mortgage on some surgeon's house or his car payment on a Ferrari or some sort of that nature. Join me this Wednesday. I promise you're going to walk away with some really good information. And then guess what? The information is there and you get to make a decision. We'll talk about, gout arthritis. We'll talk about psoriatic arthritis. We'll talk about, all those things. Then there's dozens and dozens of different types of arthritic conditions from rheumatoid all the way through. But would you like to know how to fix them? Would you like to know that there is a possibility that a lot of it is within your hands? I may even touch upon this thing called rotavirus and, how it's treated very unsuccessfully, if you will. And when we get into the rotaviruses, there's a bunch of them. I did a presentation about 2 years ago, when we were still playing with COVID, maybe a little longer now, and a group of about 200 doctors. And I was talking about a way of going after viral patterns, particularly the COVID virus, and what could be done and how it shuts it down. And then your body can be kicked back into repair process. Well, we're going to do a similar situation this Wednesday evening. Dr. Browning and I are going to go back and forth. We're going to tag team a little bit, and then I'm going to do some demonstrations. I'm going to show you what is possible with fixing a joint space. I'm going to show somebody who has weak thigh muscles and their knees are hurting them. And I'll be able to turn it back on right in front of you. I'm going to show you how we can make that happen. And then I'm going to connect the dots for you. I'm going to tell you how they interconnect and the things that you need to be aware of, what you need to do, and show you that there's a choice. It's not something that you have to say, oh, well, this is the way it is for the rest of my life. And we're going to show you why using nonsteroidals, as I said, the NSAIDs are not good. We're going to show you why some of these other drugs that they're using out now, these immune suppressive drugs, are problematic in the long term, and the side effects that they can cause. So if you're on any of these things and you want to know what it's really what the triggering mechanisms for other disease may be, show up Wednesday the 10th at the Roselle Center for Healing in Fairfax, and I promise you, you will not be disappointed. We're going to really get into the why behind these types of things. We're going to talk about rheumatological problems and viral patterns as well. We'll show you what that is and how to really interpret these tests that your doctors do one of instead of multiple pieces that really give them the directive. We'll talk about what happens when there's these things called cytokines increase and eosinophilia. And what am I talking about? Eosinophilias are white blood cells, and they kick in when there's a problem with an allergic something that's going on in the body. We're going to tie in the adrenal system. We're going to tell you why that IgA antibody is so important. And if it's not at a good level, you're going to have a problem. If it's way too high, you're going to have a problem, and things progress much more rapidly over a period of, years, if you will. And I don't want that to happen to you. I want you to have the tools to be able to change virtually anything that goes on. So we're going to talk about this viral arthritic situation. We're going to talk about all the other types of viruses, and we're going to talk about the degenerative conditions that occur because your liver's not working the way it's supposed to, because you weigh too heavy around the waistline and putting pressure on your back and on your knees. And by the way, spinal stenosis, you go to the doc and says, well, you have stenosis. You ever stop and ask them, what does that mean? Well, I'm going to tell you what it means, because it's an arthritic type of condition of the spine, and it's a narrowing of the canal where the nerve comes out of the spinal nerve root. It comes out, it's getting crushed. There's a lot of pressure in it. You get some doc that wants to go in and open that back up and put spacers in there, or fuse it, or do a laminectomy, or to give it room. You don't have to do that. There's other ways of making a difference in 90% of the conditions. Now, if you let it get to the place where you got bone on bone and you have, a destroyed joint, it's no longer there. You couldn't even get a piece of Kleenex in between the two disc spaces. Maybe, that's a different story. And there's some really good guys out there, people who I respect that do amazing work. But there's a lot of things you can do before you get there. And that's what I want you to know. I want you to understand how to shift it, how to change it, how to make a difference, because you can. You don't have to, you don't have to put up with it. You really, really don't have to put up with it. So join me this Wednesday evening, and we're going to make a difference in your life. We're going to show you how to turn this around. We're going to show you how, you can have control across the board and make life a lot easier. Wouldn't you like to be out of pain? Wouldn't you like to have all the tools that it'll take to resolve virtually anything that goes on? Well, this is your opportunity, and I promise if you come, that we'll make that happen. Go to drtomroselle.com, register for the class, or go to rosellecare.com and register for the class, or 703-698-7117, and we will have a good night for you in store. We'll give you all kinds of things that will make a difference. We're coming up to that part of the program where we're going to have to start saying, hopefully we'll see you in a couple of days. But next week, and by the way, join me immediately after this. Go to drtomroselle.com or go to any of your favorite social media sites and join us for Ageless Health live stream. I've got a great program. It's going to be Dr. Haley Parker is my guest. You'll really enjoy her. She's amazing. I promise you, you won't be disappointed. You're listening to Dr. Tom Roselle Live. And remember, I continue to do this for one reason and one reason only. I love you all. You have a great Sunday, and be careful with the eclipse tomorrow. Be really careful. See you next week. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Chronic Arthritic Pain on Wednesday, April 10th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.